So again, thank you for being here. My name is Andrew Knightlick. I'm the founder and director of the Center for Executive Coaching. I run a full practice in coaching as well as training and certifying coaches. Most recently, I'm real proud that I released the book Coach, which you can get on Amazon. I live in Sarasota, Florida with my wife and 3 kids and the Jack Russell Terrier that you may hear during this webinar as I work from the home office. And I absolutely love coaching. It truly has changed my life. It's a privilege to be able to coach professionals. And today what I want to do is take you through what I think is one of the best niches to be in as a coach, if you think of an industry as a niche, and that's healthcare. And I want to talk about 12 big coaching opportunities in healthcare. And actually there's a 13th if we have time. Okay. So the goal today is I want to introduce you to 12, or let's say 13, because there'll be a bonus opportunity in healthcare. And the way we're going to do this, it's really a whirlwind tour. Okay, I'm going to move really quickly and give you a Cliff's Notes version of how to address these opportunities. So in some ways, I'm just planting a seed. In our Center for Executive Coaching program, we'll spend a week on each of these opportunities and how to implement them, and we have toolkits. Here I want to give you a high-level overview of opportunities that I've seen in the market. So we've done introductions. I want to start with a little talk about the mind shift needed for you as a coach to get into these opportunities. Talk briefly about the need, get into the 12 opportunities, share a 13th bonus opportunity if there's time. I'm assuming this will go about an hour and 15 minutes. I'm going to spend no more than 5 minutes per opportunity. Ask questions anytime as well. And then we'll take some questions at the end, although I'm always available for questions. Okay? So let's jump in. First of all, why the Center for Executive Coaching? Why me? Why us? The Center for Executive Coaching attracts a lot of individuals from top organizations, and we seem to have a cluster in the healthcare space. A lot of people in healthcare come to us to get trained as coaches, and I've worked with a number of healthcare organizations. In fact, every opportunity I share with you today, I've done it usually multiple times at different clients. But we've had individuals trained from Partners Healthcare, Kaiser Permanente, the Laser Spine Institute, Carillon Clinic, Ascension Health, Navicent, AstraZeneca. I've worked with Pfizer on some consulting projects. I've worked with Scripps. I've worked with Partners and Kaiser on some consulting and coaching projects. And so we know the space. None of this that you'll see today is theoretical. And in fact, one of the problems with a lot of coach training programs out there is that they're theoretical, they're full of pseudoscience, fluff, ethereal talk of leadership, and that's not what we're about. We're about getting results for clients. We do the work, we get results. It's as simple as that. Everything we do is market facing. We start with the ICF core competencies, the same way that a driver's education school starts with the government requirements, and then we go way beyond those. And I think that's what sets us apart. So let's start with a mind shift that some of you might need. Those of you who are practicing coaches or aspiring to be coaches, you know, there's a lot of hang-ups that coaches have that I think keep them from being successful in the market. And you see 3 of them on the left side. One is this union mentality. You know, I only coach. I'm a pure coach. If you go that route, I think you're not only leaving a lot of money on the table, but you're missing opportunities to be a true trusted advisor to your clients. Similarly, those who say, you know, it's ICF core competencies or bust. That's all there are. If we're not following the ICF core competencies, we're not coaching, and I don't want to do it. And therefore, people who have both of these mindsets typically say, well, I'm not going to do consulting. I'm not going to do facilitation. I'm not going to do training and potentially other professional services. They're all out of bounds. The shift that I encourage you to make, if you haven't already, is just to focus on the client's problem. Forget all this neurotic discussion that coaches have about what is a coach, what isn't a coach, and focus on the client's definition of value, which is typically solving their problem with the best solution possible for their budget, their needs, and their situation. Clients care about results. They don't care one whit about the underground coaching union that talks about what coaching is and isn't and all the purity that coaching's supposed to have. All right, so I think if you can make this mind shift, if you haven't already, you're going to find that this presentation is really, really valuable to you, and frankly, you'll be more successful in the market. So what's the need? I believe it was Drucker who talked about the fact that running a hospital, and back then it was running a hospital when Drucker made this quote, is the hardest thing that any leader, manager, or administrator can do. Nowadays, hospitals have formed healthcare systems and organizations, and so if anything, it's become even more complex. In the United States, we have Obamacare, or formerly the Affordable Care Act, that makes delivering care more complicated and challenging than ever before, even more challenging than the transition to managed care. When I first got into healthcare work, everything was all about the transition to managed care, and now we've upped the complexity and the challenges even more. In any given day, any single leader in any single healthcare organization faces, I think, a lifetime of pressing challenges, certainly more than their fair share compared to leaders in other industries. And at the same time, most healthcare leaders have years of education, right? Some of them are physicians, many PhDs, masters of public health, masters of healthcare administration. But very little of this is focused on true leadership, on truly leading complex organizations. Maybe a course or two, but really what you get are administrators who understand protocols, procedures, rules, or clinical issues. And so it's very rare to find a healthcare leader who really understands what it takes to lead a complex organization successfully. If you combine all of this with the changes in reimbursement, the requirements for patient satisfaction and how that will tie into reimbursement, the changes in technology, understanding billing and revenue cycles, challenges in patient flow, competitors coming out with carve-outs to do specialty surgery, ambulatory care, diagnostics. I mean, this is one heck of a challenge. If healthcare leaders were divers in the Olympics, every single one of them would have a 10 in complexity in terms of the dives that they're doing. Nothing is harder than running a healthcare organization. So that's the need. Within that need, I'm going to share with you 12 and then a 13th opportunity for you as a coach, but often what you need is a combined solution that includes and goes farther than coaching. And they include engaging and mobilizing, accelerating change, changing the culture, helping physicians who also have moved into leadership, developing nurse managers, supporting performance improvement initiatives, helping high potentials get even better and advance, developing the board, planning for succession, improving collaboration and teamwork in what's usually a siloed organization, what I'll call the leadership tune-up, which is basically helping leaders become more aware and better, and creating a culture of success through coaching. The 13th is strategic planning. So what I'm going to do is spend just a few minutes on each of these. That's why it's a Cliff's Note version. And ask questions anytime. And again, in many ways, what I'm trying to do is plant seeds for you, just to open up new possibilities for you to see what you can do in this industry. So let's start. Number one, engage and mobilize. Now, why this picture? This is Captain Picard from Star Trek: The Next Generation. So this is a little bit of a nerdy reference. Captain Picard was famous for moving the Enterprise forward by saying, engage. And he'd raise his hand and say, engage. So some of you get this reference, some of you don't, but it's worth 25 seconds. So here's the problem. In healthcare systems, it is very common to see low engagement scores when organizations go out and survey employee engagement. And there's a number of reasons why. Among them, you have legacy staff that have been there forever, no incentives to change. You have multi-generational issues, very hard to recruit new clinicians. You have 4 generations there. It's really harder. It's becoming harder and harder to recruit good people compared to other types of organizations that offer more flexibility, because what you have here is a 24/7 organization. Many employees just don't have the education to be prepared for the amount of technical change that's going on. You have managers who lack skills, never had a good role model when they were coming up through the ranks, and they don't have any time to engage. They're so busy fighting fires and going to meetings. And leadership has what seems like ADD when it comes to top priorities, so if they try to make engaging and mobilizing a priority, often they get distracted and seem to lose interest. So you have a really big problem here. What's the solution or the approach? I've done this in a few places, and what works every time is the following approach. First is creating measurability, tracking and measuring engagement. Usually when I come into an organization, they have engaged a survey firm that has measured employee engagement. So this is a great time for us to get involved as a coach. Next, leadership has to buy in that this is a significant initiative and they're going to stay focused, that this is one of their top 3 strategic initiatives. If it's one of 150 initiatives, and I've worked with an organization that had 150 strategic priorities, that's ridiculous, right? It's not going to happen. Next, leadership has to go first and model the ability to engage and be engaged. In a lot of health systems, you see leadership just doesn't seem to have the energy, and they can often be arrogant, demeaning, condescending, hard to reach, not spending time developing their own people. Next, once you have the top ready to go, it's great to train and coach managers on how to engage and mobilize. The Center for Executive Coaching gives you a PowerPoint that I've used and others have used that's brilliant in delivering the best practices in employee engagement. It works in healthcare, it works outside healthcare, but I've delivered it to a number of healthcare organizations with great results. And once the managers are trained, we can coach certain managers that need help. In fact, after the training, their homework is to present their plan to improve their own engagement scores. And we're going to reward them for improving scores. So we're going to bake in compensation and incentives and performance review criteria based on improving employee engagement scores. We're going to remove managers that don't improve scores. This is a real challenge in healthcare. Healthcare has one of the lowest involuntary turnovers of any industry other than perhaps government. There are a lot of issues removing managers that don't improve scores. What I've seen when I've come in and coached people about this issue is that once an organization removes a manager or managers that simply aren't focused on engagement, it's like there's a sigh of relief in the organization. Another key aspect of the approach is removing structural obstacles to making engagement happen. I talked about the firing process. A lot of organizations, the biggest complaint is, well, why don't you fire people who don't focus on engagement? Why don't you put some teeth behind this? But there's also meeting structure. A lot of managers are double and triple booked every day with meetings. And yet in some organizations, some health systems have made it possible to have just 1 day a week of meetings. And so meeting structure gets in the way. You can't engage employees if you don't have time. Similarly, I've worked with some systems that have cut out of the budget ways for individual managers to recognize and acknowledge employees, for instance, with little gift certificates for going the extra mile. So if all of these things are in place, especially the measurement, the tracking, coaching, training, leadership modeling, what engagement means, you have an organization that has a good chance of improving employee engagement. It's a hard, long process. One organization I've been working with for about a year, and they're making headway, but there's so much change that it's an ongoing challenge. The Center for Executive Coaching has a great toolkit and PowerPoint for engaging and mobilizing employees. What I'm trying to do is give you the Cliff's Notes version. So this is the first opportunity, again, ask questions anytime as you go. A great opportunity for you as a coach is to align yourself with a company that does employee engagement surveys in healthcare or anywhere and be part of their total solution to get results, because surveys alone won't do it. There's a lot of coaching and organizational development work and training work you have to do. Okay. Let's keep going. So let me take you through the second one. There's some good questions here, though. Let me just stop for a minute. Let's see. How do we define what we do for clients that's unique from, say, a consultant in the marketplace, but someone who does or doesn't coach? So basically, how do you position yourself is the question. The answer is I position myself. The first thing you have to do is say, I help X to get Y. So I help healthcare leaders and executives engage their teams and become a magnet hospital or health system. There's a designation called nursing magnet. So if you do that, then the next question you have to answer is why you? What's your edge? What sets you apart? Okay? So let's keep going. Good questions. In terms of employee engagement survey companies, my recommendation is you just Google them and reach out to them. Number 2 is accelerate change. There is not a healthcare system on the planet that isn't struggling with change and isn't frustrated with change, right? So part of what I want you to hear from this webinar is cues that there's an immediate and urgent problem that you can help with, right? The first one, engage and mobilize. What I hear is, our engagement scores are really low and we're frustrated, or it's really hard to recruit people, or we're getting a lot of feedback that our managers are not engaging as well as they could. Here, the CEO that I work with simply said, I'm really frustrated. I was at a former organization. We moved fairly quickly to make change happen. At my new position, we're struggling to make change happen, or I'm frustrated with the pace of change. And there's nowhere to hide in healthcare. Change is a must, and it has to happen effectively. So here's the problem. As I said, this is taking too long. That's what you're going to hear. And part of the reason is in healthcare, you have employees who understand fighting fires, but they don't understand how to work through a complex organization to make changes to processes and systems. You have employees that just don't have any time. It's just piles, you just hear priorities piled one on top of the other. There are too many competing initiatives. You also get employees who are pretty savvy now. They realize that most CEOs leave every 2.5 years, and so they've learned how to wait for the revolving door, one leader to another. Also, because of the nature of leadership there, the lack of focus, the number of priorities, a smart person, a smart manager can resist change. They can get away with it by being passive aggressive, by saying the right things in meetings, but quietly not doing anything. Combined with that, you have leaders and managers that lack skills in how to influence and how to set the tone. And you also have leaders and managers who tend to go rogue when it comes to delivering a consistent message about the change. So look at this. This is wonderful. This is a great problem. I want to get involved in organizations that have these issues because I can help them. So let me give you an example of what worked. And I've done about 7 change initiatives in major health systems. Okay, so I'm pretty confident in this approach. First, I want to start at the top by call it a 360 verbal, right? You know how you do a 360-degree verbal assessment of a client? Well, I want to do a 360 of the executive team and the change process to see what's working and what's not. I also want to do some sort of off-the-shelf assessment of each team member and of the team as a whole. I'm partial to the Profile XT, and that helps me get a real sense of what the team is going to struggle with in their communication and certain behavioral traits. From there, I typically have started with a small retreat with the core executive team, maybe 5 or 6 core executives. And we're going to have some straight talk about what's working and what isn't. I'll interview them before, and during a 1 or 2 day meeting, we're going to really talk about what's in the way, and we're going to come up with a plan and accountability and commitments to move forward and clear the obstacles. I'll probably coach that team a little bit, and then we move to a retreat with a larger executive team, typically 15 to 20 people. We expand the list of invitations to set a new tone, come up with new commitments and accountability. You see what we're doing? We're cascading down the organization. We're also going to come up with a clear communication template that talks about why we're doing this, why the need for change at the organizational level, so that everybody's grounded in that and nobody goes rogue, and then everybody who is a manager has a mission or a homework assignment to create their own message for their unit. How does this apply to their unit? What's possible here? Sometimes there's changes in roles that are needed. Usually there's 1 or 2 executives that are resisting the change, and the best thing that your client can do, hopefully the CEO or COO, is get them out of the way. And then you're going to do ongoing coaching to support the CEO and key executives in keeping their commitments, in building a constituency that supports the change, and moving forward. And again, the Center for Executive Coaching has toolkits to do all of these things, all grounded in real results, focused on executing effectively, leading change, influence, and we talk about a process of how to make change happen. Okay. One of you asked, well, how do you get the commitment and trust of somebody in healthcare if you don't have any healthcare background? Well, I like to use that's exactly why you should hire me. So if you have no background, if I say to you, you have no background in healthcare, you need to come up with, that's exactly why you should hire me. And it's usually a twist on turning your weakness into a strength. So I would say, well, that's exactly why you should hire me. You have plenty of people with experience in healthcare and your organization's struggling. Maybe it's time for a fresh perspective like the one that I can bring. Okay. So that's 2 out of 13. Next, I want to talk about change the culture. Again, the presenting problem here is the CEO, the COO will say, I just don't like the culture here. We're too sloppy, we're too slow, we're too bureaucratic, we're too siloed. And I want you to keep in mind this metaphor of this chocolate fountain. Just see this chocolate fountain, because that's going to be the key to culture change. So here's the problem. There's a lot of dysfunctional cultures in healthcare, too bureaucratic. Have any of you seen collaboration run amok? This is where everybody seems to have to say yes, and if one person says no, a whole initiative is derailed. So it takes forever to get things done. It's really frustrating. That's a big trend these days, people will say, well, you're not doing it my way, so you're not being collaborative. You see sloppiness, you see reactive management. The other problem is that leadership does it inauthentically. They implement the culture change inauthentically. So for instance, they'll go on a big retreat somewhere fancy and come back all refreshed with a set of values, and they'll just say, go implement these values. They abdicate. Or they'll engage their marketing department and come up with a lot of fanfare, like a fancy name for the culture change, big newsletters, but there's no substance. They're just hoping that the culture will change. The worst is bringing in the whatever way, depending on whichever company happens to be in the news and successful, like the Toyota way, which suddenly stopped when they had trouble with their braking. The Disney way, the Ritz way, I suppose the Google way or the Facebook way will be coming soon. So this is how not to do it. Let me tell you how to do culture change. In fact, there's a great article in yesterday's Wall Street Journal called "The Culture Ate Our Corporate Reputation." It's by Lou Gerstner, former chairman of both IBM and RJR Nabisco. And you might want to look that up. So here's how I do it. Look at this chocolate fountain again. Think of this as the org chart. At the top, you have the CEO, then the next layer, the next layer, the next layer. So you should have beautiful chocolate, pure, delicious chocolate pouring down from the top through all layers of the organization. The problem in many organizations is that the chocolate is not pure. In other words, what you get coming from different managers or levels is something that looks like chocolate, but certainly does not smell or taste like chocolate, if you get my drift. But the approach works really well. You want to start at the top and make sure by working from the top to the next level, to the next level, to the next level, that the culture essentially gets implemented properly, starting at the very top. So we're going to work with one leader at the top to define what does culture mean. And I don't want fuzzy culture adjectives. I want to know what are the key behaviors and habits you want to see from your people. What's the performance you want to see? So if it's we want to be lean and mean, what does that mean? What's lean and mean mean? How are people spending their time? What are they doing differently? We got to get granular. And then I'm going to have the leader first model these behaviors and set the tone. So I might do some behavioral coaching with the leader for 3 to 6 months, figuring out, well, what are you tolerating? Where are you modeling the behaviors incorrectly? For instance, I work with the CEO of a health system who was working so hard and traveling so much that he sometimes was not as respectful as he needed to be with employees. However, he wanted to create a culture of respect. Well, one day he walked into a meeting after probably no sleep for a day and a half, and it was a big town hall, maybe 200 people were there. And a manager maybe 3 levels down asked some sort of question. And this CEO thought it was the dumbest question ever and started reaming this poor manager in front of everybody. Totally disrespectful, never apologized, but killed the culture right there because people realized this is not a respectful culture. We just have to play and pretend it is. So leaders set the tone. Once the leader's ready, we can move to the next level of leadership. The leader will have a meeting and say, look, you've probably seen some changes. I just want to be clear what our culture is and what I expect. And here it is. Here's what our culture needs to be in specifics. And the leader will also have one-on-one meetings with direct reports. Some to say you're doing a great job, some to say you need to change, some to say, maybe this isn't the right culture for you. And that's it. You lather, rinse, repeat. In parallel, you have to change some of the systems, right? It's not enough just to talk and model. Maybe we change the compensation and incentives. We change the budget. We change systems. And this is what you'll see in Lou Gerstner's article. Again, it's called The Culture 8R Corporate Reputation. It showed up yesterday in the Wall Street Journal, yesterday, October 4th. And again, we have a really nice methodology for culture change. We give you a toolkit. We talk through this in depth. All right. Let's move on. 4, help physician leaders be better. Did you know that there is an entire coaching niche called disruptive physician coaching? If you didn't, there is. Here's the problem. Physicians are super smart, heavily trained in clinical issues, but they are often not trained in the soft skills. Now, yes, they're trained in bedside manner, supposedly. They're trained in interviewing patients. But when they get into admin, and a lot of them want to get into administration, they don't have any training in leadership. They don't even understand the requirements. They don't know what leadership really means. Not only that, it's a huge culture change for them. I mean, imagine being in the surgical suites, you're king of the world, and you have to go into all these collaborative meetings. It's very frustrating. Also, because of the way many physicians have been trained and the respect they've been given as physicians, they might have some abrasive issues or have behavioral blind spots that could hurt their effectiveness, even destroy their career. Worst of all, they're arrogant, with all respect to any physicians who happen to be on this webinar. Many physicians don't know what they don't know, but they think they do. And at the same time, many are burning out. So you can imagine that if ever you wanted to coach somebody, and you like coaching really intelligent people who are frustrated, as long as they're open to help, which they usually are, because their career can be destroyed if they don't change this, right? They want to get into leadership, but they don't know how. You have a great opportunity here. The solution, first, you need a know where to hide assessment process to uncover opportunities to improve, right? So I want to do a 360 verbal. I want them to see how they come across to others. I want to do an off-the-shelf assessment. And again, I'm partial to the Profile XT. Physicians and other scientific types tend to love it. It puts the person on a bell curve so they can see how they compare to others in the population. It looks at their thinking style, their behavioral traits, and it's very data-driven. So it fits in beautifully with their mindset. And then what we're going to do is identify a couple of things to work on and do situational coaching about how to handle daily leadership challenges. So the coaching plan tends to include behavioral coaching on one thing they can improve on, and maybe a curriculum of different leadership topics so that they start to get the equivalent of a MBA in the soft skills required. You can also do group coaching of physicians in a system so that everybody gets peer support. And sometimes I've done it where I layer in some sort of real initiative. This really helps because then they're seeing actual improvements, right? Physicians tend to be very practical. They want to see something like reductions in medical errors, improvement in utilization, so that everything is applicable and results driven. So it's not, I don't want them saying, look, this is just all airy-fairy. I want them to set some goals for whatever it is they're tasked to do in the organization. And again, we have some great methodologies for behavioral change. We also have some methodologies for developing key skills that people like physicians, scientists, clinicians, anybody who's technical or highly educated but hasn't learned the soft skills need to succeed as a leader. Okay, yeah, one of you says these are accidental leaders. That's a great quote. And yeah, this applies not just to healthcare. A lot of you are saying this is how universities and academia are in your comments, and that's exactly right, right? What you're seeing here applies to many places. I'm just trying to make it specific to healthcare today. All right, let's keep going. Now, there's physicians, but the backbone of any health system is nurse managers. Nurse managers run the unit. They are the heart and soul of any health system, period. Unfortunately, they rarely get effective professional development. And I've run the numbers on different units. I mean, there's highly variable performance in terms of employee turnover, use of overtime, clinical utilization, labor cost per day or per incident, non-labor costs. Heck, I've even seen some nurse managers where it's so bad they don't even know how to order supplies properly. You see them storing expired medicine in the ceiling tiles of patient care rooms just so that they have medicine available, but they leave it up there like squirrels. And so you have all this expired medicine sitting around that they never get to. I mean, they have no role model. I've called it management by mom. Basically, their mother is the only role model they've ever had as a manager, and so you have a very maternalistic, somewhat condescending approach to management. That's all they know in some places. So there's a really nice opportunity for you not just to coach, but to go even further. For instance, I've done in a number of organizations what's called the Nurse Manager Leadership Academy, where a group of nurse managers meet monthly, and they'll discuss their issues. We'll give them some content about different aspects of nursing management and leadership, and they'll even have a team project. So everything they're doing, they're applying to their unit. They should be coming back every month with new results based on what they've implemented, but they might have a team project to help the overall health system as well. At the same time, we got to get the health system helping us. I really believe that coaching should be tied to metrics. So here we can look at variability in everything from overtime usage, all the things I just talked about, so that each nurse manager knows where they stand and how they can improve. I should have mentioned variances in the budget as well, right? Some nurse managers just nail the budget. Others don't even know how to do it. There's an opportunity to mentor new nurse managers, either creating the mentor program, training mentors, or you can coach them yourself, depending on your experience. And then I need leadership to set the expectations and the tone. Nurse managers can't do anything if they don't have a leadership group, particularly a chief nursing officer, chief of staff, that absolutely models, mentors, teaches, and develops people. You get what you tolerate in any role. That's one of my best coaching questions is, what are you tolerating? And this is certainly something that comes up a lot. So sometimes you might have to coach the leader team first. And again, if you join the Center for Executive Coaching or not, we have a turnkey academy, a high performance coaching academy that you can use for any new leader. And we also have the tools that you can use to put together a program like this. Okay. A question here is like, are you coaching them? Are you telling them? It's a little of both. It really depends. When it's coaching, I want to set goals with them and use coaching skills. But sometimes they're going to say, Andrew, cut it out. Just tell me. You know, this is torture, right? Bad coaching is when you know the answer and you're trying to lead them to it. If you know the answer, you shift to being directive and saying, you know, look, can I take a time out from pure coaching and share an insight or a framework with you? When we do the Leadership Academy, what I want to do is get the nurses talking to each other, the nurse managers talking to each other and sharing their own ideas, you know, and stepping out of the way. So we talked about physicians, we talked about nurse managers. What about performance improvement initiatives? Every single health system I know has a number of performance improvement initiatives and they're frustrated. Why? If you ask them, they'll say, we can't execute, and they're super frustrated by that. A lot of people in health systems, from frontline managers, frankly, to senior executives, really don't know how to develop an idea and present it for approval, especially in a highly political organization. Not only that, once they get an idea approved, there's just a lack of accountability and follow-up, a lack of skills and maybe willingness, maybe they're afraid or they just don't want to do it to get an idea accepted throughout the organization. And why do you see a black belt here? Because there's something called Six Sigma overkill. I get a lot of complaints from healthcare leaders. They say, everyone here's taking Six Sigma stuff. We have lots of black belts, but no one knows how to make anything happen. Okay. So what's the solution? What I've done very successfully is establish performance improvement teams. But only if you first say to the leadership, look, what are you going to take off employees' plates, or how are you going to get some more resources in so that this is not a burden for them? If you really want to do it, you have to free up the resources, right? That's a law of physics, right? The project management triangle is getting it done on time at a certain quality in a certain cost. If you're giving employees the responsibility to improve performance, you have to give them resources and time, or you're going to get lousy quality. And many healthcare leaders, heck, many coaches, many people don't get this very basic triple constraint. So we establish performance improvement teams. For instance, there might be a team on diagnostic services. There might be a team on patient flow, a team on clinical utilization, a team on medical errors in a particular surgical area. And, you know, they can sit, if you've ever been to these meetings, it really is torture. I mean, these folks can sit around talking about it all day long and never get anything done. And so as a coach, you could be a coach, a trainer, even a facilitator, and train these folks on just the basics of conversations that move things forward, how to make decisions, how to evaluate without analysis paralysis. And you can be this objective outsider who moves them forward, and that can be really valuable. At the same time, one of the things we have in our leading change template is a really toolkit, is a really clear template to help employees, especially in healthcare, present ideas, get buy-in, and have open conversations about, you know, why aren't people on board? so they can clear obstacles and get rid of the people who just want to veto things. The next part of the solution is you have to track progress to goals, right? If the goal is, for instance, to reduce medical errors in a certain area from X to Y, right? I want to see a big board with here's medical errors today, and I want to see them tracking it and promoting it and talking it up and communicating it so that everybody knows what's going on. Once again, leadership has to put rewards in to reward those who are successful and deal with people who resist. And once again, this means leadership needs to be focused and set the tone. I don't want to do any of this work if they're sticking me in with the middle managers and I'm not working with leadership, because it will fail. Okay, there's too much inertia in health systems and too much feeds up to the top. If I'm not working with leadership, I'm not doing this work. And again, we have the toolkits and methodologies for those of you who are thinking about a training program and are frustrated with the fact that there's so much airy-fairy, life coachy baloney out there. Pseudoscience, all that stuff, academia. We're not about that. Okay, this is real, practical. Number 7. High potentials. A lot of health systems struggle with succession planning and high potentials. In fact, a lot of organizations do. And so wouldn't it be nice if you could help out here? Here's the problem. First of all, a lot of high potentials, especially in healthcare, they just feel unchallenged and underappreciated. One of the reasons is there's no performance incentives in nonprofit, especially health settings. Right? Maybe they get, the most raise they're going to get is 3%, maybe a small bonus. It's really hard. It's not like they get stock options. It's not like they can get a $20,000 bonus. There's not a lot of compelling performance incentives. Also, why do we have a can with no label here? It's meant to represent generic. Traditional training and development is generic and ineffective, especially for high potentials who want to be challenged. And so, you can help here. A lot of systems have the 9-box thing where they identify high potentials, but then they get a little bit bogged down in what to do. Well, here's what I've done with some of my clients, and it's worked really well. One is the High Performance Coaching Academy that we offer separately. You don't even have to join our training program. It's a separate turnkey offering where you get the academy. As a facilitator, you get the participants guide, and essentially you're inviting a selective group of high potentials in to meet every month. They're going to do peer coaching. Everything bakes results in, so that you're going to give them some content, but not like in the spirit of here's some principles of leadership. More, here's a concept. Here's how you get things done in an organization. Now your homework in the next month is to set a goal, something you wanted to get approved throughout the organization, and you're going to come back and report on how you did. So it's real, it's applied, it's meant to be prestigious and selective. And then you can do some one-on-one coaching. Or you can work with the internal coaching group to do this. So for instance, I'm working with a multi-billion-dollar system now. They're on their 3rd cohort of High Performance Coaching Academy. So they've done it with 3 groups of about 18 to 24 high performers. And the internal coaching group is also coaching these individuals. They set clear goals. There's a clear coaching curriculum that includes a lot of our toolkits. And they're distinguishing coaching from coaching as a last resort or progressive discipline. We had to do some work to change what coaching means so that people see it as a privilege and a benefit. And so what you see here is a bell curve, and the goal is to take the high potentials just to the right of the median and move them even further to the right. Okay, a lot of great questions here. Many of your questions are about coaching in general. And so, again, if you're thinking of getting into a coaching program, let me know. Just email me and we can set up time to talk. Let's see, here's a question. Are the clients the high performers or the coaches of the high performers? The client for me is always leadership. And then let's say the other clients will be the high performers if I'm the one leading the academy. What I've done with many of my clients is I train them to lead the academy, and it's often the internal coaching and training group that does that. So my clients are also the internal coaching and training group. But I only do any of this if I'm working directly with a leader. The minute that leader leaves or gets distracted, this is going to fail. That's the biggest problem with healthcare, and frankly, any organization. Okay, let's see. How do you get these folks to commit to the time for the coaching and training when they're so pressed for time? No, great question. The answer is you don't do this. You don't agree to this unless there's a commitment. I put the commitment in my contract. So for instance, even if I'm doing a 2-day retreat with healthcare executives, my contract says you, whoever's signing the contract, will make sure that these people show up from start to finish with no cell phones or distractions, and that they're excited to be here. That's on them. If they're not willing to sign to that and keep their word, I'm not doing it. Right? One of the problems with a lot of coaches is they have low self-esteem, and you get yourself in trouble because of that. You know, you're so happy to be working that you don't set yourself up for success. Don't let that happen to you. I'll ask you, what do you tolerate with your clients? I don't let my clients get away with too much, because I know that the minute they start thinking that coaching is not a privilege, there's not a lot at stake, they don't have skin in the game, the coaching and the whole project is going to go south. Number 8, developing the board. This is really interesting. Healthcare is so complicated that few members of a board, and here I'm typically talking about nonprofit and county or government-based health systems, they don't understand the issues. Many of them don't even understand how to read an income statement and balance sheet. You also, in many health systems, you have pretty politicalized boards. You know, they support the nursing union, or they support physicians, or there's something about the community, or they have their own agenda. And you have some pretty weak people on the boards. Not always, but, you know, some of them. So there's a lot of opportunity to develop boards. First of all, as always, you can do a 360 assessment of the board as a whole. We at the Center for Executive Coaching have a PowerPoint and a toolkit that talks about the key competencies of board members, not just in healthcare, but in general. In addition to looking at the board as a whole, I like to ask board members to do a self-assessment of their own key competencies, and they're pretty honest. They know. And then we could do some training on specific competencies of being on a healthcare board. Sometimes I'll bring in some experts who talk about different healthcare laws, things like that. We also want to work on clear roles, boundaries, and expectations. For instance, sometimes board members talk to the media when they shouldn't. Sometimes board members think that they're managers when they're not, and they can get in trouble or cause trouble because of that. And then we talk about, well, what does the board need as membership to both reflect the community and get support for its strategic initiatives? Okay. This is good. One of you saying, in our organization, leaders are committing to their own professional growth by attending coaching sessions with me. They have to see the value in our sessions. The coaching process is part of a comprehensive strategic plan to grow our leaders. That's perfect. That's how it needs to be. Good. Thanks, Brenda. So anyway, board development. I love working with boards. For you as a coach, it's great, because if there's a 12 to 18 person board, guess what? You have the opportunity for 12 to 18 referrals to other organizations, because board members typically are leaders in an organization and also on other boards. All right. I hope you're finding value in this. Again, I told you this was going to be a whirlwind tour, Cliff Notes version. I just want to open up. I mean, look at all you can do in one organization. You could be there. You just have a couple of clients in healthcare. It can sustain your whole practice. Number 9, planning for succession. So why do you see a Band-Aid here? Because usually healthcare organizations have a Band-Aid approach to succession planning. It usually means, hey, we have someone who's leaving, or I'm leaving, and I got to figure out who my successor is. That's not succession planning. That's not a process that's baked into the organization the way it would be at a similarly sized for-profit institution. So the solution, we have a whole toolkit on succession planning, and basically it has a 3-step process. Step 1 in the process is we have to understand the current and future needs of the organization, right? You can't do succession planning without having a clear strategy, a clear direction. Next, we got to get the house in order first. You can't just backfill roles. You have to have a really coherent, compelling strategy for recruiting the best people, developing people, retaining people. So you're going to get right back to engaging and mobilizing, creating a culture. I mean, a lot of things go into a strong succession plan. If you're talking about succession planning as part of the fabric of what the organization does. Then once you've done those two things, then you can do what's called traditional succession planning, right? Who are the flight risks, right? Who's at risk to leave? What are the key roles that need succession? Who are key internal candidates? This goes back to developing high potentials. And what are the ways to challenge people to compete for these different roles or to develop into these roles? And again, the Center for Executive Coaching, we're blessed, and I'm pleased and actually proud to be able to offer a full toolkit and methodologies to help you help your clients through succession planning discussions. You can do this where you're coaching a leader. Often when this happens, the leader will then say, look, I got to do this with my executive team, and before you know it, you're facilitating. And this will lead to all sorts of opportunities. Number 10, improve collaboration and teamwork. Here's the problem, expressed in a very clear photo. What you have in many healthcare systems are silos. These are grain silos or some sort of silos. And that's what their org chart looks like, with big aluminum metal boundaries from one silo to another. In fact, in some organizations, they call it the horseshoe effect. If someone in the middle bottom of one silo wants to talk to someone at the next silo, they have to go up 3 levels to their manager, who's standing on top of the silo, calls to the manager on top of the other silo, who then gives permission to go down to the next person and the next person and the next person. So it takes forever to get anything done. You have a lack of skill, you have a lack of will for collaboration, and you have these strong walls in health settings. So how do you help? We have a really interesting toolkit for this where I challenge my clients to look at each and every unit and how they can improve collaboration. So we're going to assess opportunities to improve collaboration. We do this internally, and then we look at collaboration externally. And then we're going to have open, honest discussions about what's needed to collaborate better. Part of this toolkit, by the way, includes resolving conflict. So often, for instance, you'll have a laboratory that's so frustrated because they have a clear way to prioritize which test to do first. And you only are supposed to say that a test is stat or urgent if it really is. But because the lab systems and resources are sometimes a little bit challenged, everybody just says stat or urgent because they know they're going to have to wait too long for their test. And so there have to be open, honest discussions about what the lab needs, what the units need. And again, you could be a great coach and mediator to help different parties collaborate better. And here, I think it's really important to understand the thinking styles and behavioral traits of each party, which again is why I'm so glad to be working with a world-class expert on the Profiles XT, because I can very quickly learn about, or help my clients learn about, different styles. Sometimes the problem starts at the top. For instance, I worked with one health system where the COO and CFO hated each other and were both competing for the CEO role, and their attempts to sabotage each other's work and make each other look bad rippled throughout the organization. And so until we fixed that issue, which led to the CFO resigning and bringing in a more collaborative CFO, nothing was going to happen. A good collaboration should have clear metrics. Once again, Center for Executive Coaching is all about measuring results. Collaboration should have metrics. And then we're going to coach participants to help them overcome challenges in making the collaboration work, right? Because there's going to be setbacks. And again, we have toolkits for collaboration, resolving conflict, building great teams. Let's see, one of you asked, what role does the organization's HR and OD team play in initiatives and interventions? Well, they're partners, right? The issue for us as coaches is sometimes HR and OD folks internal in health systems aren't respected. in the system. And so, like it or not, us coming in from outside, what do they say? That somebody with a suit and a suitcase is instantly respected in many organizations. It doesn't make sense and it's not fair. But what that means is, we can help internal coaches and OD teams have more credibility. In fact, I often coach these teams on their power base, their messaging, their positioning, because they have to market more than many external coaches have to, because they only have one client. Catherine says this is a tough one to market. Yeah, good point. This often comes up during work on change leadership, accelerating change, and performance improvement. It also comes up during creating a high performance culture. So sometimes this one comes up a little bit later in the process or as part of another process. So very nice point. Okay, we're coming up to the end. 2 more and 1 bonus. This is my favorite type of coaching, leadership tune-ups. There's not really a problem, so we jump right to solution. Essentially, a leader comes to me and says, I just want to be better as a leader. I love that. I hope you love that too, and I hope you've been able to work with clients who just say, I just want to get better. So what do we do then? Well, then it's real simple. We start with an assessment to figure out or really assessments. I like to do 3, a 360 verbal. Again, I've mentioned the Profile XT, or you can do another off-the-shelf one if you're partial to one and it's validated and reliable, right? That's another thing. I'm learning that there's a lot of off-the-shelf assessments that are really bogus, and you have to watch out. Make sure if you're using one that it has a great reliability score, great validity. And then I use what we call the Leader's Dashboard. The Leader's Dashboard is a tool that on one page gets down everything that's important to the leader. Vision, mission, values, edge, key priorities, key performance metrics, relationships, and what they think they need for professional development, and it leads nicely to a coaching tool. We're going to identify the one thing to get much better, right? The highest paid coaches, I've interviewed a number of them. They're so simple in what they do. They just work monthly with clients and they pick one thing to help the client get better. I tend to work every other week with the highest clients, maybe meet with them for a couple hours every other week. So we'll do some behavioral coaching so that they get feedback from their team. And then we'll do some situational coaching on key issues, plus a whole leadership curriculum, right? We have 27 toolkits at the Center for Executive Coaching. So it's real easy to say, look, we have some extra time. Where do you stand on this topic? And they love that. We pick ways to track and measure progress so that in 6 months to a year, there's clear improvement. We get clear feedback that the behavior is better, that they're having more impact. And this is just a wonderful way to coach a leader. 12, the final one before the 13th bonus one, create a culture of success through coaching. There's a lot of talk about this as a buzzword. Okay, what's it really mean to create a culture of success? So here's what you need. 1, you got to have a best practice set of internal coaches who can really model good coaching. Coaching has to be respected. Number 2, the organization needs to create coaching initiatives that support strategic initiatives. So the coaching should be part of something where results are baked in, right? So if an initiative is clinical utilization, well, then coaches can get involved and coach the people involved in that initiative. That way, coaching and results are married together, and coaching isn't just some fuzzy, nice-to-have thing. Another piece is managers have to be trained, right? This isn't just about internal coaching. Every manager should be trained on coaching skills and when it's right to use them, right? I've worked with some managers and gotten feedback on their coaching, and it's really bad coaching, right? Some of their employees call it torturous self-realization, because what the manager does is they already know the answer, and instead of just saying, here's the answer, they spend 30 minutes with a Socratic torture method to have the employee somehow figure out what they're thinking and read their mind. Like what's in my pocket. Employees hate that. So there's a time to use coaching skills and there's a right way to use coaching skills. Leaders, of course, need to all have coaches. How are you going to create a culture of coaching if leaders aren't, once again, modeling it and actively supporting the change? The coaches often need coaches. And then we got to see rewards, right? None of this will happen, once again, if it's not in the budget, if we're not seeing structural support for coaching. So we got to reward those managers who coach, reward internal coaches who get results. We're going to make sure it shows up in the performance evaluations and compensation. So this is something we can always partner with you on if it's something of interest. So the bonus one is strategic planning. I didn't initially incorporate this in the PowerPoint, and the reason is I grew up in a consulting firm that worked in healthcare, and they made strategic planning look so complicated that I said, you know, I don't know that it's right to include this, but I've done strategic planning with health systems, and it doesn't have to be complicated. Okay, but let's just make sure you understand the problem here and why healthcare strategy can be intimidating, right? First of all, a lot of health systems just have so many potential priorities and no resources. And the priorities are everything from increased revenues, decreased cost, improved quality, look at the capital equipment, you know, what new services do we offer? What's our geographic distribution? You know, what about labor and recruiting labor? You also have a lot of political agendas that lead to conflicting priorities. It's hard to set strategy because so many people want to get their 2 cents in. You also have a lot of competitive threats that are really challenging. There are carve-out companies that do specialty healthcare services like MRIs, PET scans, you know, diagnostics, lab, surgery, and then you have larger systems that are coming in too. But what I've noticed is it doesn't matter. I can still apply our 3-part strategic planning framework and get great results, because what these organizations lack is a structured way to think about strategic planning and get buy-in. And so the 3-part planning process that we have that works really well is, first of all, we spend some time on the big picture strategic questions. You know, who are our clients, customers? What are growing areas? Who are our competitors? What are our products and services? What should they be? What shouldn't they be? What do we do best as an organization? You know, what's our strengths, weaknesses, opportunities, threats? But all of these are not to get perfect information and analysis. The purpose of this first phase is to come up with potential priorities. And so by the end of this process, whether you're doing it through coaching model or facilitation with a group of executives, is you'll have maybe 20 potential priorities. So phase 2 is narrowing down the list to 3 to 5, as well as maybe an overarching theme, you know, expand into the next state, or go national, or clinical quality first, or no medical errors. And the 3 to 5 priorities are critical. I find it really challenging for health systems to get down from multiple priorities to a few, and this is where you can be so valuable. The third phase is making sure that the organization is aligned and execution happens, whether it's releasing resources at the right time, or often more importantly, getting resources in. You know, taking things off people's plates. Stop doing things that aren't important anymore. You know, whether it's ending meetings or initiatives that are past their prime, or getting some new people in with new skills. And this then opens up your opportunity. You can coach one client through the process. Usually when I do that, the client says, no, we need the whole executive team here. And so in 3 retreats, I can usually get them through this process over 3 to 4 months. So you can be the facilitator, and then you can coach the client through implementation, which gets back to performance improvement, leading change, all of those things. So once again, this one ties together with many of the others. Okay. So next steps. And I'm going to take some questions in a moment, but you can get certified with us. You know, just go to centerforexecutivecoaching.com if you're not already a member. Take a look. There's 4 options depending on whether you want an in-person seminar, distance learning, ICF. Or we have if you're already a coach, I want you to check out our Coach Master Toolkit, where you can get every toolkit I described. And it's centerforexecutivecoaching.com/CMT for Coach Master Toolkit. I promise you that there's no other program that thinks about coaching the way I've described it today, which is very client and market focused, very practical, way beyond the ICF core competencies, which are great, but they're not enough. And of course, we're accredited with the ICF. If you have a master's degree or higher, we can also get you the board certified coach credential. We're approved by them. And we have a very strong healthcare cluster for networking with others. Okay. Question, are the toolkits healthcare focused? The toolkits, a lot of it comes out of my own work in healthcare, but I work personally with our members to get them focused for you. But you'll see immediate application to healthcare. And I know this because, again, we've trained a number of coaches who are working in healthcare, and they will tell you so. In fact, you can look on my LinkedIn profile and see that. So I hope you will make a decision, if you're not a member, to become one and join, whether to get certified with us or just to get the Coach Master Toolkit, which is all of our tools, perfect for people who know how to coach. Okay, so what I'd like to do now is take questions about any of these 13. I told you this would be a tour de force here, or a whirlwind tour, and it certainly is. One question is, how do you price these? I talked to you in our program about how to price. You know, each of these prices differently. Every coach prices differently. It's really remarkable, the range of different ways that coaches price. So this is something we can talk about once you land one of these engagements. Do I lead the coaching training? Yes. Everything's led by me other than the ICF mentor coaching. All right, let's see what else we have. What is membership separate from your coaching certification? Oh, good question. Well, with us, you're a member for life. Other programs, you know, you go to the training, I guess, and you're done. I have people from 10 years ago still in very close touch with, who have graduated from the program. So you get ongoing support, ongoing access to our tools, upgrades. For instance, we've just released a new 450-page textbook. And so new members get that, but previous members can still get that. They just need to email me their address and I'll send it to them. So you're a member for life, no royalties, no additional payments. It works very nicely. Okay. Here's a question. Who usually makes the hiring decision at healthcare systems and hospitals? So for me, I like to work with the CEO or a top executive. Okay. Others go through human resources. I find that that makes me more of a commodity. And so I tend to like to find the direct line leader, typically someone in the C-suite, work with them and have them, you know, tell HR, listen, here's my coach, can you add him to the list? And then I get to know HR and see how else I can help if I can. And so that means if you want to get into this, right, you need to be visible in healthcare associations. You need to know how to use LinkedIn. You need to know how to network your way into these. You need to start doing some speeches and talks, just like with any other niche. Okay, let's see, what's the structure of the high potential coaching? The way that's typically rolled out is, again, with the high performance coaching academy that we have. So some sort of academy that brings up to 24 people together every month, gives them homework. There's some one-on-one coaching in between. Maybe you could also have some separate small groups. And that seems to work very nicely. When you're talking about high potentials, you really want a leveraged model where you have groups that can give each other peer support, work together on practical approaches that get results in the organization, and then come back and talk about what worked, what didn't, what are they frustrated with. That's a really nice model. Good, and thanks to all of you who are enrollees in the program. Some of you are saying really nice things, and I appreciate it. You can go to our testimonials. I don't want to, make this too much of a sales pitch here. Good. Let's see, how is the Coach Master Toolkit different from the Instant Business Toolkit? The Coach Master Toolkit is 27 tools, or you can pick 6, and you get 4 bonus tools. So you have an option with the Coach Master Toolkit to pick your own tools, just a few, well, not really a few, 6, and you get 4 bonus tools. So you get 10, or you can get the whole thing. The Instant Business Toolkit is basically a pre-selected group of tools for those of you who want to be business coaches that will show you how to do business coaching. It's under $1,000, and we'll even give you a certificate as a business coach with that. So if you know you want to coach small to mid-sized businesses, you can go for that. That would not apply to what we're talking about here, but it is a different program that we have. One of you says, tell me more about the Profile XT that I mentioned. You know, I have a gentleman with whom I work, and I'd be delighted to refer you to him. If he's a world expert on the Profile XT and its suite of tools. So shoot me an email and I'll just connect you to him if you have more interest in that. It's a wonderful tool. Okay. Let's see, one of you says, engage and mobilize. What's the difference between a full manager training kit and PowerPoint toolkit? Well, there's if you already have the engage and mobilize toolkit, there's a PowerPoint that you can also use to train rather than coach that I've used. Okay, so shoot me an email and I'll make sure you know where to find that. Okay. Pricing is on the website. If you have any questions, give me a call. Generally, if you want to join the Center for Executive Coaching and you know the time is right and the budget's right, I want to have a talk with you anyway. We really try to make sure we get top seasoned professionals into our program. That's a real key. 90% of coach training programs, accept anybody with a pulse. We do not do that. So it doesn't take long. I just want to make sure there's a good fit. Any other questions about the content today? The 13 opportunities. Okay, good. Well, thanks.